Welcome. In this video today, we're going to talk about PRP and how it provides relief for individuals and various different physicians, healthcare providers that have stated it's not a value or wrong. If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist who helps patients have an understanding about their options for pain control. Today, we're talking about PRP and proof that it works. So one of the things that we came across in assessing this is some common literature that actually looked at this. And there was an article that was published that actually mentioned this, and it looks like the following. So it's an article from the Washington Post, which basically states, could platelet rich plasma injections help avoid knee surgery? And it goes on to say more studies may potentially be the answer, right? So when we take a look at this, it has a number of different interesting points. The first is it mentions different experiences that individuals have had with osteoarthritis and how long it's been going on for, and what they've been able to experience, and particularly when they're active individuals doing things like tennis. And what they did were traditional treatment options where they had things like cortisone and physical therapy, and the pain didn't improve. So for many patients, this is not an uncommon experience where they try using different traditional treatments and they just don't really get a response. They're like, okay, well, I tried this. I tried to see if I could be able to get this to respond, and it just hasn't had some degree of improvement. And what ends up happening is they'll go and seek out, their traditional primary care doctor and ask them, what are their different options? And normally they'll talk about, well, you have a cortisone injection, you might have the ability to have a surgical scope, or you have a knee replacement, and that's what you got. And frequently, regenerative medicine doesn't come up as a potential discussion. Well, this article talks a little bit about that. So they tried a number of different things, and then the physician mentioned PRP, which stands for platelet rich plasma, to be able to try to improve some of the issues with the tissue and improve pain. And so he gave it a try and it ended up helping, right? I got to tell you, as a physician that does regenerative medicine, that's an unusual story. Normally, what ends up happening is the patient will have a discussion with their doctor, and depending on that doctor's experience, which most of the time is limited in nature, what they will say is there's no studies that actually merit this. And one of the main reasons why they will say that is because insurance traditionally doesn't cover regenerative medicine. And that makes many patients say, well, if insurance isn't covering it, then clearly it's probably not a therapy that's going to be of use, right? And it couldn't be further from the truth. Quite frankly, the docs and healthcare providers that really use that lazy frame of thought haven't done their homework and they haven't done their due diligence. And one of the things that this article goes on to elucidate is really some details that have been ongoing for quite some time from a regenerative medicine stance. And that's the following. So when you go through and you take a look, one of the things that you can see is that different people's experiences with pain and osteoarthritis have different results. So there are a number of different therapies or orthobiologic treatments out there besides PRP. You have everything from traditional stem cell type treatment options to even considering the utilization of, prior to this, possible things like viscosupplementation. And what people have seen is that there is efficacy. So when you go to PubMed and you take a look and try to identify some of these different treatment options, you see the following: stem cell and platelet rich plasma and regenerative medicines, a review of pros and cons. And if you can be able to identify this, one of the things that it says is that basically you can see Platelets are frontline healing responses to injuries as they release growth factors for tissue repair. And stem cells are unspecialized, undifferentiated, immature cells that can divide and differentiate into different types of cells. And what they've been able to see in summary is that there's benefit to these different types of treatment options. And when you look at the following, considering the existence of such a paradigm between the use of PRP and stem cell-based therapy, future research should focus on understanding clearly define the molecular mechanisms, but efficacy and preservations of preparative methods and consensus of preparation methods among different research groups for clinical applications. So one of the reasons why they're focusing on that statement is the following, is that there are many individuals who will reference a study that will say, well, PRP, it had a different study and it didn't work. Well, not all PRP is created equal. It's like saying, well, if you have a batch of brownies that maybe a 3-year-old made in a, Miss Oven Bake Oven, or such a thing still exists, versus, a full blown bakery, that they're one and the same. There are different ways to be able to isolate for platelets, different ways to be able to concentrate, and different ways to be able to utilize their application based off of what the problem happens to be. So for instance, what you might do in the knee versus the shoulder versus the spine can be completely different in terms of how you deploy PRP. But many studies don't take that into account. They use a generalized fashion or function of platelets and say, oh, well, it didn't necessarily work. But most of the individuals who are doing those treatments are not regenerative medicine specialists who do it on a day-to-day basis to really be able to give the type of outcome that we would hope for and expect. So when we take a look at that article that was published, it goes on to talk about what are some of those differences that exist, as we kind of mentioned before. And we could really get into the differences between PRP and stem cells, and we've done that in other videos. But to kind of go back to that point of, are there standardized studies that have been evaluative of it? Yeah, there are. And so, for instance, there's different studies that have looked at why PRP should be the first choice for injection therapy for osteoarthritis of the knee. And this was a paper that you can see was published in 2018 in Current Reviews of Musculoskeletal Medicine. And in essence, what it looked at was the application of PRP in treatments of knee osteoarthritis. And what they found was that there has been efficacy and safety of PRP, and it's better at some of the earlier stages of osteoarthritis, and probably should be a treatment that's used early on. When we go back to take a look at that article that evaluates different therapies in the post, it talks about there have been some that have looked at the 80+ articles and said, well, we're not sure whether it's beneficial or not, and we're going to recommend against it, which is really just stupid. I don't know a better way to be able to say that. Not because we use PRP, but really because when you look at the cost benefit analysis from a patient standpoint, not from an insurer standpoint, not from a medical system standpoint, not from a provider standpoint, what you're really trying to weigh is how much can you improve pain and function, and what are the downsides to potentially being able to do it. And when you're doing PRP, the benefits are huge for the type of potential risk, particularly when you're using autologous cells, meaning it's coming from yourself, that you have. And so they found a number of different regenerative medicine individuals who are kind of the key opinion leaders. And so one of which is a doctor that uses PRP and has found that, that PRP application is definitely different for different people. But at the end of the day, when you're talking about mild to moderate osteoarthritis, it can certainly be able to help. And there are different types of therapies that are reliant on benefit, particularly when you look at knee osteoarthritis. There are things like microfragmented adipose transfer and bone marrow aspirate, which can be able to provide benefit. And when you compare that to steroids, you can see that there's a major difference. So there's a paper that looks at the following: the long-term benefit of steroid injections for knee osteoarthritis. And what you can be able to see is the following: is this paper was published in, or kind of review was published in 2017, and it was noted that knee osteoarthritis affects more than 9 million Americans. It's a leading cause of disability and medical costs. And probably some of the most common treatments for osteoarthritis is the following, and that is a direct injection of corticosteroids into the knee joint, right? The problem and the issue is by doing this a single or repeated time, is that it only shows some degree of modest improvement, despite this being a mainstay of what many primary care doctors will do and what many orthopedic surgeons would consider doing. And so there was a study that looked at 140 patients that were evaluated at Tufts in Boston for symptomatic knee osteoarthritis and evaluated it over 2 years. And what they found is that although it did have some improvement in knee pain and some stiffness, that there were changes to knee cartilage. And that knee changes in cartilage resulted in thinning of knee cartilage that were present. And that loss of cartilage in the steroid group was significantly greater than in the controls, meaning that there was a faster loss of cartilage in the steroid treated group compared to those that didn't have steroid that were applied. So what does that mean? What that means, when kind of broken down in summary, is the following: is that you're trying to feel better. And what the traditional initial treatment option is it potentially worsens your long-term outcome. Well, what type of sense does that make? Where you might feel better in the short term, but because insurance covers it and it's been always done this way since the 30s, then now it makes sense to continue to doing that when studies have shown that it's harmful. Makes no sense whatsoever. And so when we go back to that article that looks at the use of corticosteroids to treat osteoarthritis, it can improve inflammation, but it also decreases cartilage and has had destructive effects on cartilage, right? So why continue to do that? It doesn't make any type of intuitive sense. So when we go back to that article that looks at it can actually hasten cartilage loss, then what can we do that can do the exact opposite of that? And that's when we start thinking about regenerative medicine and how it can be able to provide benefit and what it can do in order to help patients get better, feel better, and do better. If you're watching this video at a later point in time and you're feeling this is giving you some new things to think about, is giving you some insight in terms of how to be able to improve your own condition or someone that you care about, please hit the like button. And if there are videos like this that you think you'd like to learn more about, regenerative medicine, treatment options that exist that are not necessarily always the mainstay for pain and musculoskeletal conditions, please hit the subscribe button so you can learn more and we can be able to provide you more insight. Continuing on, one of the things that this paper talks about, or this article talks about, is what are the different studies that are out there that can be able to assess pain, mobility, and function, and how this might be impactful. There's 32.5 million Americans who have osteoarthritis, and it traditionally centers around cartilage, which is the cushion, as we know, for the bones within the joints. And as that breaks down and wears away, bones rub against each other and cause a whole host of different problems. While PRP doesn't traditionally regrow new cartilage, it can delay its loss and it can improve some other healing factors that are in place. And so when we take a look at PRP, we compare it particularly in the context of how it does with knee osteoarthritis, there are a number of studies out there that have analyzed and compiled information that has said, you know what, how important is this? And so this meta-analysis took 14 different studies or trials, and then they evaluated them across 1,350 patients that were included. They looked at not only pain scores like the VAS, but they also looked at various different function scores like IKDC, WOMAC scores, and others to be able to identify was there differences. And what they found is that PRP compared to different treatment options like Synvisc or things like Deflexa, which are viscosupplementations, have obvious advantages, and that those treatments with PRP can reduce long-term pain and certainly can be able to improve knee joint function. And so when I hear patients come to me and they say, well, you know what, my doctor told me that there's no benefit to PRP and that they're most informed. What I want to know is, what studies are they utilizing? What have they done to be able to assess this? How have they been able to determine that there's no benefit when you do a simple PubMed search and you can find tons of benefits for PRP, and how it's been able to be impactful on patients across multiple different pain complaints and musculoskeletal issues? As we go back to that paper, there's a number of other things that we can be able to take a look at that talk about what do you do if you have a moderate to severe case and how to be able to deal with it. And there are other treatment options that exist within the orthobiologic spectrum or regenerative medicine. And so that's when you can be able to use that microfragmented adipose or bone marrow to be able to treat directly to those areas, because it's a different treatment option than PRP. And for those individuals, they can be able to have a significant improvement. One of the doctors that they quote is a fairly well-known regenerative medicine specialist who's an orthopedic sports medicine specialist who actually has been able to provide a fair amount of benefit to his patients by using just such treatments as these. So when we look at how this has been labeled in this category as being off-label, it's really a misnomer for the degree of benefit that potentially exists for patients. So when we talk about the efficacy of PRP on tendon and ligaments, there's a number of meta-analyses that are out there since the early 2000s, but certainly in the last 5 to 7 years, and have been a number of increases that have seen. So for instance, this meta-analysis looked at 37 articles with 1,031 participants and evaluated them across multiple different spectrums. And they were able to show that in addition to knee issues, they're able to improve elbow and shoulder issues in terms of pathology. And it really is a robust treatment option for patients that frequently isn't mentioned and has good science behind it. So when you are able to say there's science behind it, there are continual studies that are being done, it really just is aggravating to hear patients told, well, there's no studies and there's no science, when indeed there truly is. And so for those patients that haven't heard it, go take a look on PubMed, search it for yourself, and then come back and present it to your physician, your nurse practitioner, your physician's assistant, or your other healthcare provider who's told you PRP, no, that really is probably not going to be useful. Let's do a total knee replacement instead. What? Look into it for yourself, evaluate it, and know that there's science that has actually been able to support it, and that science is continuing to support it by more and more studies that are exponentially growing to show the benefit behind PRP, behind stem cells, and regenerative medicine as a whole, and figuring out what manner is best in order to be able to improve candidacy and outcomes. Again, if this video has been of value for you, please hit the like button. And thank you so much for tuning in and supporting our channel and supporting different cutting edge treatment options for how to be able to punch pain in the face and get back to the life that you deserve. Thank you.